Good morning, everyone. This is Courtney from Prevent Blindness Wisconsin, and I want to welcome you to our workshop number 2 of our Diabetes and the Eye series. Today, we're going to dive into those common eye diseases we see with diabetes or prediabetes, and we're going to link on what we learned last week on those 5 common tips and tricks to help us monitor our vision health, especially if we are at risk or diagnosed with diabetes or prediabetes. So just to do a quick recap, I'm going to go over those 5 common tips that we gave. So number 1, knowing your risks. Are you at risk for diabetes or prediabetes? Does this run in your family? Are you maybe in the demographics where it is a little bit more high to have diabetes or not? Tip number 2 is really going to cover those blood sugar levels. So having that A1C of 7 or below. Again, this is that marker we really try to stress in the vision health world, but this is going to be dependent on each individual. Listen to your eye doctor, listen to your primary care doctor, and go with what they recommend for you. 3, being aware and mindful of your lifestyle factors. So, do you have a healthy diet? Do you exercise regularly? Are you exposed to smoke? Do you smoke? All of those factors can play into vision health, but they can also play into that prediabetes or diabetes. 4, getting regular dilated eye exams. I know I got on my high horse last week on this, but this is so important. This is the only way for us to really diagnose and look at the health of the eye. And especially if that prediabetes or diabetes is present, this is really going to be that make or break with early treatment or early prevention for us. And lastly, don't wait if you have a change in your vision. Talk with your eye doctor. Changes in vision could be something simple, or it could be something that is an early warning sign, and we want to make sure we're getting that checked out and monitoring it regularly. So a lot of us have seen this infographic. With this, I think the fact on here speaks miles just to the impact diabetes can have. 1 in 4 people living with diabetes is affected by retinopathy of the eye. So this can depend on all severities of retinopathy, very severe, the proliferative stage, which we'll cover, or non-proliferative. 1 in 4 people, that's a significant amount. The other thing I want to mention here too, diabetes-related retinopathy is the #1 cause of blindness in American adults. Working age US adults is that main cohort we're looking at here. 1 in 4 and the #1 cause. So that's why we want to talk about this. That's why we want to raise awareness. Now today we are going to dive into what retinopathy is, how it affects the eye, and those other diabetes-related eye diseases. But retinopathy is more so of that huge umbrella disease, and then you do see a lot of these other ones falling underneath that category. So eye diseases associated with diabetes is, again, diabetes-related retinopathy. We then have diabetes-related macular edema, cataracts, and glaucoma. I know I covered a couple of these last week too, very briefly, but I'm just going to go into how does diabetes affect the onset of these. So first we're going to cover that retinopathy piece. So you might be asking, Courtney, you're saying retinopathy so much, what does this mean? Well, what we learned about the eye last week, retinopathy of the eye really affects the back of the eye. So the image here, this is representing the retina of our eye. And last week I said the retina of our eye is very similar to the foundation of our eye. So very similar to the foundation of a house. We want that to be strong and supportive. That's the same thing with our retina. We want that healthy, fully functioning. This is the main area diabetes truly affects with our eye health. So you can see what retinopathy is basically is those fluctuating blood sugar levels with diabetes or prediabetes can really affect the blood vessels in the back of our eye, in the retina. So with this, it causes them to become weak over time. So the top half of this image, you have a very healthy retina, a normal retina. As we progress down, you can see this is where retinopathy is happening now. All of these blood vessels that feed our eye, give it the nutrients and the blood flow, they start to become weak. We see these little mini bulbs occurring. Those are little mini microaneurysms. So Essentially here we have blood that pools in the blood vessel and eventually it breaks open. Again, those blood vessels are weak, they're not as strong, and that's when we really start to see this fluid, excess blood, scar tissue build up on the retina. So there's two different stages of retinopathy. Everybody starts off with what's called non-proliferative retinopathy. This is a fancy term for the early stages of it. Here, again, those blood vessels become weak over time. Blood vessels might begin to balloon and swell, again, forming those little microaneurysms. If our normal blood vessels aren't working like they should, the body's natural response is going to say, oh, you know what? I need to form more blood vessels because my eye is not getting the nutrients, it's not getting the blood flow that it should. So then we can progress to a more serious form, and this is called proliferative retinopathy. These are more of the advanced stages of the disease, and essentially what's happening here is those normal blood vessels aren't doing their job like they should, so the body says, let's form more. Now, the issue with let's forming more blood vessels is these are abnormal. They're not supposed to be there. They're not the original ones. So these typically are more weak as is. Once they form, they can cause scar tissue to form in that retina and the vitreous body of the eye. This is called neovascularization. The body needs the blood nutrients, so this is the initial response. Again, typically everybody starts off with non-proliferative and then we can progress to that more advanced stage here. Both can have permanent vision loss occur. Obviously, as we go to that more severe proliferative stage, we do have that more advanced vision loss that we see in individuals. Typical signs and symptoms of retinopathy, again, we mentioned last week, those flashing lights, sudden increase in eye floaters, that's something I would definitely give that eye doctor a call or go in and see them as soon as you can, just so they can monitor what's going on. Again, diabetes or prediabetes can affect vision health very, very quickly, and it can progress quickly. With this though, a lot of people don't have early warning signs, so if they don't go into the eye doctor regularly, even if they don't know they have the diabetes or prediabetes diagnosis, that's when we really start to run into some issues. Other symptoms might include halos around lights if people look up at lights, more blurry vision, double vision, maybe a swelling, so again, that blurry vision, things not appearing as clear with visual acuity, but the most common that we do see are seeing flashing lights, the sudden increase in floaters, and some people might almost have what looks like a cobweb in their visual field too. So if you notice any of these symptoms, please do not wait to contact your eye doctor. The next condition that we have under that retinopathy umbrella is going to be diabetes-related macular edema, or DME for short. Essentially, what's happening here is on our retina, we have a little notch in the back of it called the macula. The macula is responsible for picking up fine details and is responsible for us seeing in our central vision clearly. What happens here is from retinopathy, if we have all of these blood vessels not happy, if they're leaking, if we have excess fluid, what happens is that can actually damage that macula on our retina. And that's when we really have that central vision distortion. About 10% of people who have retinopathy will progress to DME or form DME. Again, too, if we have abnormal blood vessels now forming on or underneath that macula, that's going to really adjust how we see things in our central vision as well. Common symptoms of this, again, blurry vision, double vision, but also that sudden increase in eye floaters as well. Sometimes people think, oh, I have DME, I started off with DME. We have to start off with some type of retinopathy for that to then eventually affect that macula and the health of it. So the next diabetes-related eye disease we have is cataracts. And again, we mentioned this a little bit in our first workshop, but essentially what's happening here is cataracts form in the lens here, right behind the iris and the pupil. So for us to see things clearly, we need light to come in through a nice, beautiful cornea, come in through a nice, clear, transparent lens, and come to a nice sharp point on the back of our retina. What happens with a cataract, though, is the lens over time becomes cloudy. If this is cloudy and not clear, that's going to affect how light comes into our eye. So then you can see with a cataract, light is more scattered across the back of the eye instead of coming to a nice sharp point like this one. And that's why things appear blurry, hazy. We have that reduction in visual acuity. Again, those common symptoms of cataracts are going to be that reduction in what we would be able to see, so reduction in visual acuity. We might have some issues with harsher contrast. We might have light sensitivity, poor night vision driving at night. That's a very common symptom we hear from people. And then a frequent change in glasses prescriptions. So if you go into the eye doctor and it affects your prescription after getting it 3 months, that's something they might look at the lens of the eye and say, okay, maybe this cataract might be getting a little bit severe, or it might be the early stages of it. With cataracts, the one message I want to hit home here is diabetes influences the onset of cataracts. So those with diabetes form cataracts more quickly than those that don't have the disease. What's happening here too, again, those early stages of diabetes too, the lens of the eye can swell up, so that's why some people have blurry vision, is say if they wake up one morning and then it can go back down to normal when blood sugar levels come back down to that stable level. So this is more so of that early sign. If A1C levels increase, the eye doctor might say, hey, maybe we need to get that A1C level under control first, and then we can determine that situation on, is this impacting that cataract formation more quickly than expected. The other thing here too is with diabetes, it actually releases an enzyme in the eye, and that can build up on the cataract, on the lens, excuse me, and that forms a cataract more quickly too. We call that sorbitol. And the last diabetes-related eye disease we have is glaucoma. So when you think of glaucoma, I want you to think of this associated to the pressure levels in your eyes. So essentially, glaucoma is a group of eye diseases that affect and damage the optic nerve. And the optic nerve is located on the back of our eye, right behind the retina. And this is the main communication system between the eyes and the brain. So this carries all those light signals the eyes take in, and it sends it to the brain, which then puts together what we're seeing. So there's 2 different types of glaucoma. There's more, but these are the most common that we do see. We have open angle and closed angle glaucoma. So open angle glaucoma is more common. It progresses more slowly in individuals. And essentially what's happening here is we have a gradual increase of pressure in the eye. Our eyes have all of these drainage systems. So the eyes produce this aqueous fluid. Canals in our eyes carry those fluid out to the rest of our body, to the circulatory system, and then we produce more fluid in the eye. So what's happening with open angle glaucoma is the angle for that fluid to flow out of the eye itself into the canals, that's nice and open, so we can see that in the term. But somewhere along the canals or the meshwork that filters out that fluid from our eye, there's some type of cloggage occurring. So fluid can still get past, but it's going to be at a slower rate. So that's why pressure builds up gradually with open angle glaucoma. Closed angle glaucoma is more of that serious type that we see. Essentially what's happening here is the angle for that fluid to flow out of the eyeball into the meshwork and canals of our eyes, that's closed off. So pressure builds up rapidly. So what's happening here is there's nowhere for that fluid to go. So that's when a lot of individuals can experience severe vision loss from this condition. Common symptoms of this that we look for is a severe, sharp, consistent pain in the eye. Not dry eye, not allergies, that sharp, consistent pain, but also too underneath the eyeball on the lower lash line, you can almost see that it could be bulging out a little bit. That might be excess fluid that's building up in that individual's eye. So if you experience any of these, please do not, 1, hesitate to call your eye doctor right away, or 2, if you cannot get in, we do recommend people go into emergency care because this can lead to severe vision loss rapidly for someone. Common symptoms of glaucoma, we call this the sneak thief of sight because a lot of people do not know they have it, especially if they don't go in for regular eye exams. With this, someone can have glaucoma if it's open angle for 10 years and not even know it. The picture shows it beautifully. It is that gradual, typically side vision loss, peripheral vision loss, and then it can overtake that central vision for someone. Again, some people might have blurry or foggy vision. Some people might start in central vision, just depending on the person. But the most common is going to be that side gradual vision loss. If glaucoma runs in your family, we do consider you at risk for the disease just because it is so hereditary. With this, they're doing more studies into how diabetes is linked to glaucoma, but they are finding that in that proliferative retinopathy stage, we might form blood vessels in that vitreous portion of the eye, or it could start to come more towards the drainage canals of the eye, which can really cause more blockages than we need, increasing that pressure in our eye. So out of all of these conditions, again, the biggest thing here is, are we getting regular dilated eye exams? That dilation piece is huge. Again, in undilated people, they have a very narrow snapshot of what's going on, and then a dilated pupil, they can see everything. So if we have blood vessels that are acting up, what does the optic nerve look like? What does the macula look like? And really zoning in on those. Again, people with diabetes or prediabetes should be getting a dilated eye exam every single year. Adults 18 to 59 years old, if you do not have any risk factors for vision concerns, if they don't run in your family, we recommend about every 2 to 4 years. But again, listen to your eye doctor's recommendation. A dilated eye exam is the only way to diagnose every single one of these eye diseases we talked about today. And I want to cover some workshop 2 takeaways, just like we did in workshop 1. So again, if you experience changes in your vision, please don't wait to contact your eye doctor. It can really save sight if something really is going on. Being aware of your risk factors. Again, do you have diabetes? Do you have prediabetes? And how often have you been going in to get your eyes checked? Do you have symptoms? Do you have symptoms of vision changes? Again, monitoring those A1C levels, we really like to see those at 7 or below. And lastly, receiving those regular dilated eye exams is going to be key for individuals. I hope you enjoyed workshop number 2. I hope you learned a little bit more about diabetes in your eyes. Join us next Monday for our last workshop, workshop number 3, where we cover that prevention and early detection and why it is so important. I hope everybody has a fantastic Monday. Thank you for joining me.